is Angela Nachanzi, and I am the country manager for Thinkwell Uganda. Thinkwell is a health systems development firm that comes to transcend the status quo and help developing countries like Uganda purchase services or innovative financing mechanisms. We do human resources for health, public financial management, but our niche is healthcare financing. And currently in Uganda, we are implementing strategic purchasing for primary healthcare project, which is an investment by the Bill and Melinda Gates Foundation to help governments in the project countries strategically purchase maternal and child health or services as well as family planning. Where I see Thinkwell going in the next 2 to 3 years is a firm. This has been our foundation and we are happy we have built it well. As you may have heard, the ministry is proud of the work that we have done. KCCA is very optimistic on exploring new mechanisms in the work that we have done. So this was, to us, has been a foundation. And as we move into the strategic purchasing for primary healthcare phase 2, we want now to get into the weeds to actually say, if we are paying for results, for results at the facilities, to incentivize them to improve quality, what exactly does that mean? What systems are we talking about? What processes are we talking about? But also for the outputs. If we are extending the benefits package beyond maternal and child health, what indicators are we looking at? But also, how do we make sure that we align the principles of results-based financing to the PFM constraints or the public financial management constraints that we see? All this work has been documented, so it is now us working with the ministry to see that mainstreaming actually happens. We are going to get into the weeds to start looking at the facility outputs from the health management information system, from the quality of care system, and see how the trends of quality grows over the time. We are going to continue working with KCCA as well as the Ministry of Health, now really to concretize our findings and start implementing results-based financing for the Ministry of Health. We are moving into the next phase as their TA partner or technical assistance partner to actually get the work done. Can we see how we are incentivizing quality over the years? Can we see how we compare results across the regions, across the incentivized indicators? Can we see how we get the regional structures that have been promising to do an oversight function to actually work as they've envisaged in this mainstreaming strategy? Are kinds of pieces of work that we are going to be doing. This has been a symposium for us to share our learnings from phase 1. I think it went well. We have seen the partners going away with key takeaways as Thinkwell, the people that are deliberate, the people that are collaborative, but the people that are purposeful, but also bringing technical rigor in the health financing space. So us as Thinkwell, we think we are accomplished, we've done well, but the work is ahead of us. How do we bring the technical rigor that we have been using to do the foundational pieces to actually do the implementation of these policies that we have influenced? I'd like to specifically thank the Thinkwell Uganda team. It is a very lean team. It has been a very challenging journey. I know we've pushed out over 30 publications in terms of reports, briefs, and the kind of thing in a period of 3 years, including 2 years of COVID. What this actually means is that we have been working more than maybe the stipulated 8 hours, but you've worked tirelessly, and we really appreciate what you brought to the Thinkwell brand. We have been known as the people that actually do the work that matters. Let us continue doing that, but also to thank you. Thank you for all the time you have put into the work, but also the time to organizing this well-attended, well-perceived workshop. I think our footprint as Thinkwell is now imprinted in Uganda.